Welcome to The Aesthetic Effect, a podcast where beauty meets innovation. Your host is Flavio from Fiore Aesthetics.
Hi everyone, and welcome to a new episode of the Aesthetic Effect podcast. I'm Flavio, your host, and today I've got, in my opinion, a very special episode. I'm interviewing a very well-known plastic surgeon in Italy and well-known all over the world. He's an international speaker, and today we're going to cover some really hot topics within the aesthetic medicine industry. We're going to cover about new trends, what is new, and most importantly, the effect of regenerative medicine within the aesthetic effect. So without further ado, let me introduce you to Dr. Roberto Dell'Avanzato. Ciao, Roberto.
Hello. How are you, my friend?
How you doing? You okay?
Absolutely fine. Sunny day in Italy, so it's good, Flavio. Perfect.
You are so lucky. We are in England. It's literally raining every day. There's no sun at all. So you're very lucky, very lucky. Thank you so much for taking the time to talking to me today, because I know you are super busy and you've been traveling a lot. So thank you for taking the time. I really appreciate that. So just tell the viewers a little bit who you are and what you do. Just to, let them know who you are.
Okay, thanks. Thanks again to invite me. It's a pleasure to be talking with you regarding me, but not so interesting. I mean, maybe something that I have done in the past could be a little bit more interesting, but something about me. I mean, every day of maybe every year, since when I was young, I dreamed to be a doctor, a surgeon, because my parents says that since when I was 5 or 6 years old, I start to say I want to be a doctor, I want to be a plastic surgeon, and maybe because of very good, well-known plastic surgeon was a very friend of us, and maybe I wanted to imitate him, and that's something that could be the reason why I started my first experience like as a doctor and then as a surgeon. And another important part of my life, for sure, as everybody, is the family. That is important. So parents and family are always important in our daily practice but I want to talk about even my interest, that is mainly the sea. So I do apnea, and that's something that helped me to afford perfectly my work. As Dr. Amore, Roberto, where very well, we met, and he loves also to go under the water and explore the most important part of the world, because 70% of the heart is under the water. So
amazing. So it's all about keeping fit and keep your mental fit as well.
That's it. It's exactly why we do surgery is the same. So perfectly control it and do your job. Yes.
Roberto, what would you say at the moment? What would you say at the moment, or in Italy, is the most requested surgical treatment that you guys get? I don't know if it's in Italy or all over the world. What would you say is the most requested treatment at the moment?
Yeah, considering male, female, I can tell you for sure liposuction. But the new technologies regarding liposuction, and in my case, especially the laser liposuction, were already in 2006, the American FDA approved as the best way to approach the extra fat removal and the skin tightening, the effectiveness of the diode laser 1470 nanometers that is able to be perfectly,
target.
To target the water and the yellow. So mean that just the extra fat is destroyed and the water helps the laser to shrink and tie the skin. So in order to avoid the destruction of the vessel, the lymphatic system that sometimes is more common during the classical liposuction that most of the doctors continue to perform. It's cheaper because, you buy one cannula, 300, 400 euros, and you use it for the life. Instead, the approach with the technologies, with energy-based device, with the laser, that is more selective and more effective in order to have the best result that is possible to achieve, for sure.
And what would you say, like, for the viewers? Would you say what is the difference between having a traditional liposuction done with mechanical cannula or with a laser? Do you think some patient will benefit more from one procedure and some patient from another procedure? Or would you say is the main difference in between both?
All right, there is an important study over this from the published maybe 2-3 years ago, where the same patient received the classical liposuction from one side and the laser liposuction from the other side.
Oh, wow.
So that's something like a split body study. And the result demonstrate that the fat removed, not destroyed, because destroyed is more aggressive. In the past, we thought that the laser destroyed the fat. But now, considering the study over the specimen, over the fat removed with the laser, we can confirm that the quantity of the pre-adipocyte alive in the fat removed with the laser is around 92% of pre-adipocyte alive. Instead, in the classical liposuction is around 72%, but with a variable of around 2.9%, so around between 90 and 95 of the pre-adipocyte alive.
So basically, you mean with the mechanical, with the suction?
Yeah. So in the laser.
Within the laser liposuction, you basically melting the fat first, right? And then you're removing it out. Well, mechanically, you actually, you put some fluid in there, but you are sucking it without melting it first, correct?
Yes, and the quantity of the variable of the pre-adipocyte is between 50% also. That's why lasts less, in the classical mechanical liposuction instead the laser liposuction. And considering the target of the laser, of the diode laser, 1470 nanometers, that is the yellow, so you can be more selective to destroy just the fat. So when you analyze the fat sucked out in the ampoule, there's no extra blood. Instead, with the classical liposuction, there is a
lot of blood,
more blood and the rest. So even for the fat transfer, that's important, because the quality of the fat melted by the laser for the fat transfer is definitely better, because is more pure, more pre-adipocyte alive, and no extra blood or anything else. So considering this, the laser liposuction nowadays continue to spread worldwide, except for the cost, for sure, because there is the cost of the laser, the cost of the fiber, that are not the same cost that is one cannula the life. That's it. And in some countries, where it's allowed, for example, not in France, but in Italy is allowed, maybe, I don't know, UK, we can even just destroy the fat. So not laser liposuction, but laser lipolysis. So we can just destroy the fat when the quantity is not so much. I mean, maximum 100, 150, 200 cc, so in the area. So you can just, with an optical fiber, destroy the extra fat, and then wait that the fat destroyed will be absorbed or eliminated by the
unified system, and so
and macrophages and the rest. Yes.
I'm gonna ask you something. Like, this is a really hot topic here in the UK, right? And I believe in England in Italy it's the same thing. So we have a lot of patients traveling abroad to have liposuctions or surgeries in general.
Yes.
And sometimes, especially in England, it's becoming like you buying a tour guide. You buy a ticket, the hotel, the surgery, blah, blah, blah. It's like it comes as a package. And a lot of people going to Turkey these days, right? Because now, what is your real opinion on people trying to seek cheaper surgeries, because it's very dangerous. We know how dangerous it is to when you go under surgery under knife. So what is your recommendation for listeners that they are choosing to go under the knife just based on price?
I mean, is exactly when the patient comes to my office, or maybe when they try to have the first consultation, they ask me, "Oh, which is the price for a filler, for example, for a hyaluronic acid?" So my answer is always is not your first question. Your first question have to be, "Doctor, you have the hyaluronidase in your office?" "Yes." "Now tell me the price." So the first important thing is the safety.
100%.
100%. And the same when people go abroad or in some country to obtain a cheaper price. I mean, I don't want to talk about surgeon because I'm sure that everybody in any country they are very skilled, but
Absolutely,
it-
absolutely,
absolutely.
absolutely.
But the problem is when you want to all of your patient, how you can manage any complication, because remember that surgery is not mathematics. So many patient maybe comes to your office, come to my office because they cannot come back in the place where they receive the procedure, and they spend
Absolutely.
double because they have to correct also some problem that comes maybe for the. I mean, a surgery is not only in the day of the surgery; it's
Correct.
also before and after. So even your eyes can see if there is any small problem that you can even correct, or use some LED to improve the quality of the scar, or maybe
Absolutely.
inject some hyaluronidase is needed, or maybe inject some cortisone also in order to prevent any bad
Reaction or
bad.
invention.
Yes, that's it.
I'm just for the listeners. So when we mentioned hyaluronidase, so just for your listeners that you might thinking, what is hyaluronidase? What is it? So hyaluronidase is an enzyme that we use to reverse the effect of HA. So HA means hyaluronic acid. So if we inject hyaluronic acid within a blood vessel, or if we create something that we call an occlusion or vessel occlusion, when we stop blood supply, hyaluronidase is something that can be injected to reverse the effect of the HA. So we're just basically breaking down all these little molecules. So your blood flow will start again, and obviously you'll be out of danger. So that's, I just wanted to point out what hyaluronidase was. At least, the listener will know. But
Yes, I mean, even for the urgency is very important because if it's needed, you have to. There is a good friend of mine that is a doctor from Australia. Is Stephen Liu. Maybe you know him. He's very famous worldwide. And one time he did a live surgery, a live injection with HA. So he treated the glabellar line,
yes.
and during the procedure, the patient starts to say, "Oh, I'm blind. I don't see anything."
Oh,
So I don't see anything. So everybody start to be like in hurry. Everybody, okay. And then he says, "It's not true. The patient agreed that I have to do this, but just
wow.
yes. So just know which is the feeling that you feel, and you know exactly how to manage even
Yeah.
the complicanza,
Complications.
this complication." So, I mean, it's very important also to be ready to afford any possible complication, vascular occlusion, vascular compression, or even embolism. So it's very important also to be ready to afford everything. In this way, you can even work better in your daily life for sure.
And I think as well, that is probably what makes, the difference as well for you listeners as well, is that when you choose, picking someone with experience and a professional practitioner, they just don't do the procedure. They do your procedure, but then they know how to deal with everything that happens around the procedure. Because, at the end of the day, and I'm sure you probably will agree with this, especially when it comes to the non-surgical world, I'm going to use the word everyone, but a lot of people can learn how to get syringe, right? But then you have the difference between someone that actually they know what they're doing, because they don't just learn how to do the treatment, but they've learned and trained to manage complications, to manage post-treatment complications, and so on. So I think that is what makes someone from being just an injector to being someone that actually are covered 360 degrees.
Yes.
So it's very important to choose someone that knows how to look after on you when you're on the bed, but even when you're home and weeks after the procedure is being performed.
Yes.
Um,
Correct. Totally agree.
but Roberto, what is new? What is new? What is a new exciting treatment coming? Have you heard anything? There is anything new? Polynucleotide, exosomes.
Definitely
Everybody's so
exosome
excited
for
about
sure.
exosomes.
Yeah, I mean, polynucleotides are something, Ramai, is truth. So, I mean, it's very well known all over the world, and polynucleotides works in different field of medicine for sure. But I want to say some words about exosome that nowadays there are, the human exosome, the vegetable exosome, and the synthetic exosome.
Yeah.
There are some problems regarding the human exosome. Maybe some disease can be transmitted with the human exosome. Vegetable exosomes are really good. They work, but they cannot be modified. So there are some companies that invest their money in research regarding the synthetic exosome that differently to the others can be modified. So there is the possibility to create like a scaffold for the exosome with hyaluronic acid in different molecular weight, and inside you can put the exosome, and inside the exosome you can maybe add some hyaluronic acid in very low molecular weight with a growth factor, with vitamins, with different active principle, and the hyaluronic acid around the exosome protect the exosome until they reach and the cell. In this way, the changing in pH very close to the cell help the release of the what is inside the exosome, so the 100% of the product is effective on the receptors with the cell. So there are some companies and many new products that in the next year exit in the market, and I'm very happy because I'm collaborate with some companies that still do some research in order to give us the best product that is possible also for the future. So it's not just open a vial of HA nowadays, or just a vial of polynucleotides. So it's
Roberto, like this is a personal question. So here in England, for example, we have these. We tend not to inject exosomes, but we tend to macroneedle. So because exosomes need to be placed very superficially, because then they will travel down to the target cells and release whatever needs releasing.
Exactly.
So would you say microneedling is the best way to release exosomes?
Yeah, microneedling and also fractional laser. Absolutely. So yes, in the combination of both can be the combination of needling with exosome, or laser, ablative laser, so CO2 laser with the exosome. Yeah, it could be one of the best synergy to obtain the maximum result in something that is not allowed to be injectable for sure at the moment.
So would you say the exosomes, they are basically, so they need to be used as a topical solution more than an injectable, right? So you place them as topically after the procedure. So if someone has a fractional CO2, or they might have just a non-abrasive fractional laser, you can then apply them after the treatment with some active ingredients, right? And they will do the job of bringing down the molecular to the target cell and then release. Oh, phenomenal! Really good. We use exosomes in my clinic as well, and that's exactly how I use them. Normally, either macroneedling them, or I've used them after an ablative fractional laser. So, right. So, question for you. So, for all the listeners, can you explain maybe a little bit the difference between the nucleotide and the exosomes within the aesthetic world? Because I think there's a little bit of a confusion between exosome and polynucleotide. So what is the job of one and the other?
Yes, I mean, polynucleotides are very well known all over the world and very used, and many companies invest also to the polynucleotide because, but not only aesthetic medicine, also in a different, yes, for sure, because polynucleotides works and they create a lot hydration, regeneration, anti-inflammatory effect. So they have many properties and they are used in different field of medicine from many years. So they works as an active principle for sure. Differently, the exosome are like a carrier. So it's not the exosome that works. It's what you provide with exosome, what you obtain using the exosome to interact with the membrane and so how they interact with the receptor on the surface of the cells. So in this way, the synthetic exosome can be modulated to interact with different cells in different layers and obtaining different effect. That's why, I mean, both of them can be considered.
They can be, and plus, I mean, they use in a little bit of a different ways. Few days ago, I was watching something on social media, and there was a company that they were publicizing exosomes, oncological exosomes. So what they say is that they will get a little bit of blood, and they have an equipment within their clinics to be able to extract exosomes from your own blood. It's just, I've never particularly, I don't know much about that specific way of extracting them. But how can you extract exosome that quick from someone's blood in clinic?
Okay, I think that this comes from, I mean, maybe 3-4 years before the COVID, when the manipulation of blood raised to the attention worldwide. And I'm not so expert because my work is another.
Of course, it's completely.
It's not possible to obtain exosomes from our blood in so fast way. But I mean, I think that that's something that will be in the very soon
in the future,
but not yet. I mean, it's not in this way that we can obtain the exosome. Probably we obtain something else, but not the
I thought so as well.
Yes, autologous exosome. Yes.
Right. I really want everybody to know about, we kind of covered a little bit, obviously, about, the laser treatments that you do, but there is one specific machine and laser equipment that you're very well known for, because you are one of the creator of it, let's be honest. So can we introduce to my listeners exactly what Endolift does? And most importantly, would you say what is the perfect or candidate for that specific treatment? So tell us a little bit more about what it does to begin with and how it works.
Thanks for your question. I really love to talk about my creator, so Endolift. When I decide the name of the procedure, because it's not a device, it's a procedure.
A procedure.
Endolift, yes, a procedure is a method, is a technique, but then there is a device that is able to do different procedure, also Endolift procedure for sure. And with this device, I mean, you can even afford different. You can even approach different pathologies, different
part of your body.
Yes, that's it. So when I decided the name of Endolift, I thought that how works Endolift? It's not a lifting. So through the vector like this, you use the threads, you do the facelift, you can use the vector to reposition the tissue in the right position. Endolift is different. It's not this. Endolift is this. So it's a shrinking, is a tightening. So the effect of the remodel comes not for the lifting, but for the endolifting.
Shrinking.
So this is why we call Endolift like this. Then since 2009, changing the wavelength, because before when I started in 2005, 2006, the 14, 17 nanometers doesn't exist. So nowadays, in 2009, in the last 14 years, I've used the 15 years. I've used this wavelength that is perfect to target the water, because higher is the wavelength and higher could be the effect on the water.
Yeah.
And that's why even higher wavelength in the future, like 1940 nanometers, can be used to obtain the maximum result for tightening. So the perfect patient is a patient with a sagging skin, no extra fat, no muscle falling.
Yeah.
So only skin laxity. This is the perfect patient. Then, if in the same area, for example, the under chin, the patient has also extra fat, changing the power, T-on, so the setting of the laser, you can even be effective on the yellow, be effective on the fat. So Endolift is the technique that doesn't affect the fat, but only the shrinking and the tightening the skin falling.
Fabulous.
Then, if changing the parameters, you can also perform the laser lipolysis and Endolift, or laser liposuction and Endolift. Is in the same area, the fat, there is extra fat that can be removed. The procedure is very easy because you can perform with or without a local anesthesia. It doesn't matter. I mean, if you are for the body, you can use anesthesia. In some countries, everybody wants anesthesia. But regularly, you can even case by case decide if you want to perform with or without anesthesia. So there are some doctors that perform only with anesthesia, or maybe 80-90% of the procedure with anesthesia, especially at the beginning. If you, in my opinion, if you choose the right fiber in the right plane with the right setting, you can even try without. But why not? I mean, many doctors talk too much about anesthesia, yes or no. It's like when you perform a filler, you choose the doctor because he's able or not to perform anesthesia. It's not. You have to be able to perform a filler.
Absolutely.
Okay,
Absolutely.
Then an optical fiber, bigger like, can be 200, 300 microns. So one hair is about 100 microns. So it's bigger, like 2-3 hair.
Incredible.
Is inserted under the skin in the hypodermis. So where is the fat? Where are also the collagen tissue, the connective tissue.
Connective tissues are.
Yes, and there you can release directly the energy without passing the skin. So not passing the epidermis and the dermis to reach the hypodermis. In this way, the color of the skin, if you and the TN, or maybe even some skin pathologies, or maybe some vascular lesion, you can just not consider, because you pass under everything and work directly and deliver the energy directly where is needed. So skin phototype is not important, and also so it's very useful also in different countries, for example, for Saudi Arabia or maybe China, or where we work.
And what is the recovery time, Roberto? Like, would you say it's something that a patient can do as a lunchtime procedure? Like they can have this done and maybe take a couple of days off? So what would be the recovery from doing the treatment until the patient can go back to, work?
Okay. So if we use it without anesthesia, it's a lunchtime procedure, and the recovery time is 99% immediately. So there's no advantage in area. Then, if you want to destroy extra fats and you perform a local anesthesia, there is maybe some swelling that comes in the next. You have to put some elastic band for 2 days for the tightening, because it's like after liposuction. If you don't apply any compression or any garment, you can just achieve less result, and the swelling can be just smooth. So it's not for the inside the procedure, but you case by case, you can even consider this. Regularly, when I do pure Endolift, I don't do anything before, during, or after the procedure.
And I guess also with Endolift, patients can go back to after the procedure is done and everything is gone down, it's something that can be combined with biostimulations, exosomes, or some HA. So can they use the traditional non-surgical procedures afterwards?
Yes. I mean, in 2008, I won a Enrico Follador world by the synergy of microfocused ultrasound and Endolift procedure that I really love, because the microfocused ultrasound I work a little bit deeper, also in the muscle laxity, where Endolift works mainly in the skin laxity. So together they can be combined without any injectable. But I published also a book where I combine Endolift with some very famous injectables with the biostatic point technique. So 5 injection point and 5 injection point, just you perfectly understand which is the product. Maybe we cannot say commercial name, I don't know, but it's so famous in the world. That's
Profilo. Let's just say it. Profilo.
It's so famous in the world that everybody knows Profilo, or everybody compare product with Profilo for sure, because there are many products that try to be Profilo, but Profilo is just one. And now there is a new Profilo, the Profilo Structura that we are going to present the company are going to present in October in Italy. There will be 2 main events for the launch, and there will be the launching also at the Italian Congress. So Structura will be the new Profilo, but recently IPSA, the company, also launched the new Profilo body that I really love, because it's a good quantity of product. Is a concept. It's not just open a vial, inject the vial, because inside there is also the cream, the patch, the vial. So there is a concept that to increase the result of any energy-based device for the body as Endolift, in order to obtain much more regeneration of the tissue, so much more toning of the tissue. Yes. So
Roberto, like this brings me to like a question that do you think within the future, like let's just say 10, 15 years from now, because we are getting so advanced with all these non-surgical procedures, like, your amazing Endolift or, all the radio frequency, or do you think that in 10, 15 years from now, when patients and people in general are starting to look after themselves with this treatment a little bit at a younger age, that potentially some patient will need to go under the knife? What I mean with that is that, like, if you're looking after yourself with all these wonderful treatments, do you think that potentially some patient will never need the actual surgery? Or do you think surgery will always have a good place within the aesthetic industry?
I mean, surgery remain the surgery for sure. So nowadays, if surgery is needed, there's nothing like surgery. But what you said, and what I say to all my patients, is that if we start early to increase the hydration, the bioremodeling, reduce the skin laxity, create a more stronger fascia with the macrofocus ultrasound and the rest, I'm sure that in the next year, the surgery cannot be cancelled 100%. But nowadays, if we are in between 80% and 20% of the balance between non-surgical and surgical procedure, probably in 15 years, I'm sure that a very few quantity of patients that starts today to do these, they can even delay the surgery or never consider any surgical procedure for sure, especially if like a facelift for sure.
Absolutely.
Yes, I mean, even also there are many effective procedure over the fat, extra fat, like injection for the fat melting or cryolipolysis or laser liposuction, laser lipolysis. So, I mean, also in this way, using a process that is a little bit slower, but in the next will be less needing of any surgical procedure. I mean, for the nose, for example, probably not. I mean, if you have like a septum or something, or maybe for the
years,
yes. In the past, another company tried to do something small with a less invasive procedure. But I mean, if you have this kind of ear, you cannot do too much. I mean, so But for facelift, liposuction, maybe even arms lift or
Absolutely.
tight lift or buttocks remodelings for sure. I mean, the surgical procedure for the buttocks remodeling, like Petit or Gonzalez, are very well known, and we apply. But nowadays, with the different procedure that we can combine also for the buttocks remodeling, like microfocus ultrasound, endolift, injectables, and the rest. I mean, you can even absolutely delay or never consider the implant for the back, for example. That I love for sure.
Yeah. And plus, as well, even in England, I mean, the I would probably say a few years ago, it was all about face and face and face. And I think now, actually, people are starting to realize that, the body is equally important. So here in the UK, for example, I don't think we have had the boom that, you guys in Italy or South Americas as well, or I said Brazil, the butt enlargement, butt fillers, in the UK, is not big as potentially is in other country yet. But we all know that obviously body is equally important and as face, so
Sure.
But amazing. And what do you think, like, just to bring this to, like, would you say, for example, like the celebrity, so would you say the things, like, because your career has been quite, I mean, you've been doing this for a while, so would you say would you say that since social media, since Instagram and all the apps, would you say that that has kind of modified or changed the way that people see surgery or aesthetics in general? Because we are being bombarded by images of perfection. So do you think that that has increased the popularity for injectables and for surgery in a positive or negative way?
Negative way, absolutely. Unfortunately, negative way, because patient doesn't feel the distance between the starting point and the result achieved. That seems immediately, but in the middle there is a word, and with a reduction of perception of the real risk of the procedure. As you say, the buttock filling that nowadays everybody want to do it is very dangerous procedure. Or maybe the injection for the rhino filler. You have to be very skilled, because it's one of the high risk procedure and area to approach if you don't know very well the anatomy. But even if you know very well the anatomy, you have to be ready to afford any problem. So that's why at the beginning I say to all my patients, ask me if I have hyaluronidase before to ask me which product I use, how much does it cost, and the rest, because that's the most important thing for our life. That's important. And nowadays, seems that everybody wants a rhino filler. I love the rhino filler. I know some doctors that they say never. I want to do never a rhino filler, especially in some countries. But I believe that as the other procedure have to be something that you have to believe in your doctor, ask to your doctor.
Absolutely.
Yes, not show me before and after, because before and after is always, I mean, not real. You talk with your doctor, see the doctor in the eyes, and understand that he understands what you really want, and understand which is the possibility of risk and result obtainable with the procedure.
Because the rhinoplasty, rhino filler, it's a massive thing in England. I think it's booming. And when I talk to other colleagues of mine or I'm around social media, it seems that it's something that quite a lot of patients request. Even if, in my opinion, not everybody's a good candidate for that treatment, because, we are not, we play with proportions, we play with, with lights and aesthetics. So what we do is we just increase in a little bit of volume here and there to trying to mask and to trying to create quite of a fake proportion. So we playing with our case with lighting and adjustment to make the nose look smaller and more harmonic. But the truth is that, we're not cutting, we're not removing, but we're adding to trying to make their nose look a little bit better. So I think some patients are amazing candidate for that treatment, but I think some patients are not. And I feel that these days, especially in England, everybody is doing rano, filler, where and I see sometimes some people around, with nose that they actually look way bigger than what they were to begin with. So with rano filler, I think it's important to choose the right candidate, like with any procedure.
And always when I do rhino filler courses, say two most important things. First, slow speed of injection. Second, small amount of product. So those are the two important things in order to have the best result and prevent any risk.
Yeah.
Yes.
Amazing.
The speed of injection is always important. Knowledge of the anatomy, and that's something that has to be.
Of course.
Yes.
Of course. That is number one. Of course.
The right choice of the product. We correct G prime, and that's something that have to be okay. But speed and quantity.
Yeah, that's a good one, actually. That's a good one. And I think as well, for example, a tear trough is another area that, people just inject. And then again, tear trough is a very important but very delicate and difficult thing to do because not everybody is a candidate for that treatment. And I see a lot of times, patients coming in with eyes that look like, they've got real bags. So that's another one that I think people should really pick and choose who to perform it on.
Yeah.
But yeah, listen, just the last question I want to ask you before I let you go, because I know you're super busy. I'd really like you to talk about a little bit, if you can, on that work that you've done in Pakistan, right? Because I know that I was really, because I think it's very important, because I think you helped quite a lot of people, right, with burn that were done, my understanding, from family members or for, is it like burn victims when it comes to?
Yes.
Tell us a little bit more about that, because I think it's very important what that you've done.
Acid burn victims, that's important.
That's the one. That's the word, acid burn victims. Yeah.
Yes. Yeah. At that time, I work in the burn unit in a room. So I was, and there I met a doctor, my professor, Professor Francesco Bellezza, that introduced me to this world of. And with him, I participated in 4 humanitarian mission with the company and with the foundation, and we have performed a number of flap, skin expander, laser, in order to reduce, because when the fire acts, the fire consumes the tissue. When the acid act on the tissue, the tissue. The eyes is closed, the air comes to the front, the chin is attached to the sternum. So
the tissue's down.
Differently from the fire.
Yeah.
So in this, the patient needs to receive, the patient, I say patient, but they are young ladies, young guys, maybe 8, 10, 12 years. Most of them were very young. And after that, the family threw the acid on them while they sleep. They say, okay, this is done. Now doctor, please try to fix my
child.
Because of the apparently with the social area, they do something to correct the child. Yes.
So just for people to understand. So basically, what Dr. Roberto is trying to say is that when this unfortunate accident do happen, is that some family member, they would throw acids to trying to fix a social accident that might have happened previously. That's what we were trying to say.
That's it. So, and then we did a lot of work there. So it was like a 360 degrees experience, because it was like a human experience, practical experience, surgical experience. Maybe we work in the morning in the operatory theater, then in the afternoon with the cars, we go to find some patient, because considering that the official number in that time, 2005, 2007, was around 1 a day. So just in the Pakistan. So officially, but unofficially, we found a lot of more patients going in the countryside with the car and asking, we can help you if it's possible, and please let us.
And I guess as well as a doctor, probably, like, as a doctor as well, to help to do what you've done, I think is phenomenal, because you literally change in someone's life, or at least you give them back some hope in some sense. Because sometimes you can help someone, but sometimes you probably not be able to help them fully, but you just give them some sort of hope, but that's it. That's amazing. Okay, so we nearly got to the end of the podcast. Thank you so much. Honestly, I really appreciate you being on here, knowing how busy you are. But one last question for you. What is the most enjoyable part of your work and your job in general? What is it you still love doing every day?
Absolutely, meet different people all over the world and do courses and do conferences, and like the last courses where I met you. So I mean, it was a huge congress, huge event organized with a live dissection for.
That was fantastic, by the way.
Fantastic session. So I mean, this is the most important part. I mean, love your job and meet nice people, and try to do always your best, how much that is possible to be the best doctor that you can be in your life. Yes.
Roberto, thank you so much. It was absolutely a pleasure. And when you are in England, please come and knock my door. I would love to.
I know where you are. So
number 22. Number 22 Bloomsbury.
Yes.
And it was such a pleasure. Such a pleasure, honestly. Thank you. Because I know you're super busy. And so just to take this hour off your diary, I really appreciate that. So I'm grateful for that. Thank you very much.
Absolutely.
And have a fantastic day, whatever you do. And I will see you in England.
Thank you. Absolutely soon. Bye-bye.
See you later. Bye.
Bye.
Please do not forget to like and subscribe. And stay tuned with us for the next episode.